Well, a doctor in this province is the latest to sound the alarm on the growing hospital staff shortage. He's warning that if all levels of government don't intervene soon, well, it could lead to the collapse of the province's healthcare system.
So for more on this, we're joined by Dr. Andrew Bozzari, and he's the Executive Director of Social Medicine and Population Health at the University Health Network. Dr. Bozzari, thank you so much for joining us this morning. What needs to happen from all levels of government right now to prevent this impending collapse, as you call it?
Yeah, I mean, I think one of the things, Jennifer, we've known for some time, when you look at the data about how we as a healthcare system stack up to other jurisdictions, we've had an ongoing staff shortage crisis for some time. When you look at how we compare in terms of nurses per capita, hospital beds per person, we're near the bottom to the end of the OECD countries that we stack up against. And what we've seen throughout the pandemic is that this has really been a chronic stress test after stress test. And, you know, this is in no way sustainable. So we need every level of government to be able to step up on, one, the real investments that are needed, but also modernizing and transforming the system and ensuring that we can ensure that physicians and nurses and health workers are able to do what they can for patients and families and why they got into this work in the first place.
You're sounding the alarm, Dr. Bozzari, along with other members of the health profession as well. Do you feel like governments are listening or get or understand what's actually happening?
Yeah, I think there's a bit of a disconnect, Nick. I think, I think we all want to be through what this worst stretch has looked like through the pandemic. And I understand that people want move towards the summer and ensure that, we've maybe seen the worst of what could have happened with the pandemic behind us. But unfortunately, that's not true when we look at the viability of our health system. We have neglected the kind of reforms and investments that have been needed for decades. It's the same communities and neighborhoods that have been shut out of access to the healthcare system, that have been under-resourced, that are feeling this unraveling now more than any other jurisdiction or any other parts of the city or country. And if we don't actually start to move on some of the recommendations that have been in place, again, for many, many decades, we've had reports on this pre-pandemic, pre-SARS about the modernization that has to happen, about the public investments that need to take place. And we saw just how vulnerable our system is for our elders and seniors in long-term care, to the way that people are continuing to struggle to get access to a primary care provider, or the real stresses and challenges that are ongoing in emergency departments. So we're past warning signals now. And it's something in terms of where if we don't see immediate action, all of us are very worried about the future of our Medicare system.
Dr. Bozzari, this sounds like it's a problem that can't be fixed overnight. Is some of this issue not just with hospital doctors and nurses and staff, but also primary care physicians? We reported on stories where patients are heading to the emergency room as a last resort because that's the only place where they can get looked at.
Yeah, again, Jennifer, this is really about system reform. I mean, I think there's things that can't happen overnight, but we know about the solutions that need to be put in place. And this is going to be about political will, across every level of government to really ensure that if we do value our healthcare system, that these actions are taking place. And primary care is unfortunately, a very telling example of where we've neglected the sort of investments that need to be put into place. We don't have enough team-based model care options for people. People are unable to access that kind of care. And we've also seen, because of the real strain and challenges in primary care for health workers, not being able to do, again, what they're hoping to do for their patients and families, we've seen a real drop in decline in the number of medical students going into primary care. So there's a whole set of compounding issues that have resulted in primary care. And it's really the linchpin of the system. And when you start to see that centerpiece start to be neglected, not get the sort of resources it need, not be able to recruit the number of people and physicians and nurse practitioners we need in primary care writ large, it's the patients and families and caregivers that suffer not being able to access primary care. And it all ends up coming into the emergency department, where there's also limitations on what the health system can do for people who are coming in because they've not had any other place to go.
Okay, Dr. Bozzari, really appreciate you coming in to talk about this, and we'll see if the governments of all levels are listening and can act quickly enough. Thanks for the time.
Thank you.
All right, we need it to happen. Thank you.
Okay.